Gene therapy, in its broader sense, is the use of a gene or other genetic material to treat a patient with a specific illness or disease. In the case of CF, what we want to do is take a normal functional copy of the CFTR gene and introduce it into the cells of the lung, because that's where the main problem is. Once the gene is inside the cells, it can then function as a normal CFTR gene and do all the things that it's required to do, and this then alleviates the symptoms of the disease. There are two kinds of gene therapy vectors, viral and non-viral. Viral vectors are essentially where you take viruses which infect, let's say, the lung, and you put your gene of interest, in our case cystic fibrosis gene, into the virus, and then you infect the lung with it. And these are very efficient, but there is a problem that the body recognises these viruses as foreign and then activates the immune response, and this can cause some problems. Using non-viral vectors, or synthetic vectors as they're also known, you can avoid any aspect of a virus, and this means that you can design exactly what you want, and also it avoids any problems with the immune system. Here in Oxford, we've been involved in looking at gene therapy for cystic fibrosis lung disease probably for about the last 10 to 15 years. And we started off using liposomes. Now, people know about liposomes from adverts on television for skin creams, and that's because they are fat molecules. And what we have to try and do is we take the CFTR gene and we wrap it up in this liposome, and the fat molecules dissolve into the jelly of the membrane and release the DNA inside the cell where it can work. We've tested the liposome approach in CF patients, and we've shown that it can work, that we can deliver the CFTR gene to the cells of the patient, and that it can function normally in the cell membrane. And that's all fine, but the problem is we don't know if this is going to have clinical benefit to the patient. We need to know whether this treatment will actually improve their symptoms. So to do that, we're planning a clinical study where we deliver a dose of our gene therapy once a month for a whole year. At the end of that, we'll know whether it really has had a benefit for the patient. From April 2007, all babies in the UK are now being screened genetically for the presence of the CFTR mutation, because what we've realised is that the sooner that you're able to diagnose a child with cystic fibrosis, the sooner you'll be able to treat them and to preserve their lung function. In the past, we've only been able to give the gene therapy to patients who are 16 years of age and over, because they are believed to be able to be of an age to give informed consent. But we've just been given permission to be able to deliver our treatment to children as young as 12. And this is really good news for them, because when CF patients are quite young, their lungs are actually quite healthy. They can function quite normally, and it's only as they get older that the lungs become really quite difficult to live with. And what this means is if we can intervene early enough, we can save a lot more of their potential lung function.